This study was to evaluate the effects of the anti-CGRP ligand monoclonal antibody Galcanezumab on health-related quality of life in patients with treatment-resistant migraine, which is the CONQUER study. And the CONQUER study was a study that was initiated at the suggestion of European regulatory authorities because the regulatory authorities wanted to see whether Galcanezumab would be effective in the target patients that they anticipated it would be used with. And those would be patients who had treatment-resistant migraine, patients who had had at least 2 to 4 migraine preventive medication therapies fail to work. That is, the medicines failed to work due to insufficient efficacy or safety or tolerability reasons. Most of the regulatory authorities and payers are requiring step edits to access monoclonal antibodies, and the step edits generally require at least 2 or 3 migraine preventive medications in categories to have failed due to insufficient effectiveness or safety or tolerability reasons. And the patients who have had that lack of success with treatment are likely to show decreased quality of life and increased economic burden with inadequate management. To evaluate this, what was done was after a baseline of 30 to 40 days, patients were randomized to either Galcanezumab or placebo for a 3-month double-blind treatment phase, and then another 3 months for an open-label treatment phase. What we wanted to do was to evaluate mean changes from baseline in patient-reported outcomes so that we could see whether the intervention with Galcanezumab actually had an impact on those aspects that involved patient quality of life and function. We did this at month 3 from the double-blind placebo-controlled part of this, and we evaluated the migraine-specific quality of life questionnaire version 2.1, which is a patient-reported instrument addressing physical and emotional impact on functioning over the previous month on a 0 to 100 scale. We evaluated the migraine disability assessment through a score in which you ask patients how many days in the last 3 months were you at least 50% disabled at work, home, school, or recreational activities, and it is scored from 0 to 270. And we also evaluated patients using the European Quality of Life 5 dimensions, 5-level visual analog scale, which is a patient-rated scale of general health status. The baseline demographics in this study were very similar to all of the migraine studies that are underway. Over 80% were women, over 80% were white. The average number of migraine days per month, if you took the total population, was over 13. But if you subdivided and looked at the episodic migraine patients, they had over 9 migraine days per month. And in the chronic migraine population, they had 18 or 19 migraine days per month. And the duration of migraine was over 20 years for everybody. And the number of comorbid conditions was was over 4 in almost everybody. Just a little bit under 4 comorbid conditions for the episodic Galcanezumab group. But the baseline demographics look pretty similar to what we're used to seeing. And getting to the results, Galcanezumab significantly improved the MSQ, the migraine-specific quality of life, in domain and total scores for all populations. And this included role function restrictive, emotional function, role function preventive, and MSQ total, so that one could see benefit for the Galcanezumab compared to placebo, really evident in month 1, but Our primary outcome was in month 3. Next, we evaluated the migraine disability assessment score at month 3. MIDAS is collected across a 3-month period, so that's why we looked at that. And for the total population and the episodic and chronic migraine subpopulations, there were very significant drops in MIDAS scores, with drops of over 20 for the total population, about 20 for the chronic migraine population, a little bit less than 20 for the episodic migraine population. They were a little bit less disabled at the beginning. And that's very heartening. And MIDAS, of course, evaluates days of at least 50% disability. So to have a drop of at least 20 days across 90 days is a very significant drop and suggests a real improvement for the patients, despite the patients having had a lack of success with at least 2 to 4 previous preventive therapies. Finally, evaluating European quality of life, 5-dimension, 5-level visual analog scales, again, in the total population, in the episodic migraine population, and the chronic migraine subpopulation, the changes were all showing improvement. In the placebo group, in the episodic and chronic migraine subpopulations, there was actually a worsening. In this particular study, there were no statistically significant treatment group differences. However, numerically, it looks quite dramatic in terms of what happened with Galcanezumab improving the EQ-5D-5L from a significance level. So between the groups, no difference, but overall, there was a significant improvement if you added all the patients together. So in conclusion, I think it's important to back up for a second and ask what really was going on with this study. What was really going on with this study was to evaluate patients with treatment-resistant migraine, patients in whom monoclonal antibodies are likely to be used, and then to evaluate how they really are doing in terms of patient-reported outcomes by total population, by episodic migraine, and by chronic migraine, comparing the addition of Galcanezumab to placebo. Patient functioning as measured by the MSQ, the migraine-specific quality of life, showed changes from baseline in the total score and all 3 domains, significant as early as 1 month and significant at the 3-month mark that we were interested in. Disability, as measured by MIDAS, showed the number of days with disability due to headache was reduced by approximately half. So it was 50% improvement in the total number of disabled days, and Galcanezumab significantly improved MIDAS total scores at month 3 in all of the populations, total, episodic, and chronic. And the VAS component of the EQ-5D-5L showed significant improvement in patient perception of their health state and was observed for Galcanezumab compared with placebo in the total population. And this is very encouraging news because it tells one that one can say to a patient, even though previous medicines have not worked for you, we can give you a monoclonal antibody and your functioning is very likely to be significantly improved. And in the original study, not just patient-reported outcomes, but conventional measures such as mean monthly migraine days also improved in these patients with a magnitude similar to that in the regulatory trials. I think all good news from the CONQUER study.